Okay. So have you ever had one of those dental procedures that's a little more intense than just a filling? You know what I
Oh,
mean?
yeah, I know exactly what you mean.
It can get pretty complex. And today we're going deep on dental flap surgery.
Diving right in.
Sounds kind of scary, flap surgery.
Yeah, it does have a kind of ring to it, doesn't it?
But we're going to break it down. For everyone listening today, make it way less intimidating.
That's right.
Because knowledge is power, right?
Absolutely. When you understand the terms, it makes the whole thing so much clearer.
Exactly. That's what this deep dive is all about. Taking those complex surgical terms and making them make sense for everybody.
It's like getting a sneak peek behind the curtain right into the dentist's playbook.
Yes. And I think that's a great way to think about it.
Mm.
So we're focusing on those procedures that involve lifting or repositioning gum tissue.
Right. It's not just cutting and stitching. It's all about how they access and repair the tissues around your teeth.
It's super strategic.
Very much so.
Okay, so first things first, what exactly is a flap?
Okay, well, imagine you're opening a book to get to the pages inside, right?
Yeah, it makes sense.
A surgical flap in dentistry, it's kind of like that.
Okay.
The surgeon carefully lifts a section of your gum tissue.
To get to what's underneath.
Exactly, to reach the tooth's root and the bone around it.
So it's like creating a doorway to work on those hidden structures.
That's a great way to put it, yeah.
Now let's talk about the types of flaps, because there are a few different designs, right?
That's right, there are.
Our research mentions two main ones, the papilla preservation flap
Mm-hmm.
and then the conventional flap.
Right, so choosing the right type of flap is really important. It all depends on the specific dental problem and the space between your teeth.
Okay, so walk us through the differences. What sets them apart?
Okay, well, the papilla preservation flap, it's all about keeping that little triangle of gum between your teeth, the papilla.
Right.
They try to keep that intact.
Oh, so it's all about keeping your smile looking its best?
Exactly. It's often used when aesthetics are really important.
It's like dental surgery meets cosmetic surgery.
In a way, yeah, you could say that.
But I imagine there are cases where that's just not possible to preserve the papilla, right?
Yeah, definitely.
Is that when they'd use the conventional flap?
Exactly. The conventional flap is more about function,
Mm,
making sure the surgeon has good access to do what they need to do.
makes sense.
They might use it when there's not enough space between teeth, or if the papilla isn't healthy enough to save.
Okay, so once they've decided on the type of flap, how do they actually make the cuts? What's that process like?
Well, the incisions can be done in a few different ways. Horizontal incisions, they run along the gum line.
Okay,
Those are pretty common,
I see.
but sometimes they need more flexibility to reach deeper.
So what do they do then?
Then they might use a vertical incision that goes from the gum line down towards the cheek.
Oh, wow, okay.
And if they need to shape the gum tissue, they might even use a scalloped incision.
What's that?
It's kind of a series of little curves instead of a straight line.
Oh, that's interesting.
Yeah, it allows for some really precise shaping.
So it sounds like a dental surgeon needs a lot of different tools in their arsenal.
Definitely, they need to be adaptable.
Okay, so once they've made the incision, how do they lift the flap and move it around?
That's where the terms elevation and placement come in.
Oh, okay.
Flap elevation is all about how the tissue is lifted.
So there are different ways to do that.
There's full thickness elevation. That's when they lift the whole layer of gum tissue to expose the bone underneath.
And when would they do that?
That's usually if they need to work on the bone itself.
Makes sense.
And then there's partial thickness elevation. They only lift a thinner layer of gum tissue, so less bone is exposed.
So it's all about how much access they need.
Exactly. It's like opening a door just a crack versus opening it all the way.
I love that analogy. What about the terms non-displaced and displaced?
Those describe where the flap ends up after it's lifted.
Okay.
A non-displaced flap is put back in its original position.
So they just lift it up and put it right back down.
Pretty much. But a displaced flap is intentionally moved to a new spot.
To do what?
Well, it depends on the goal. They might move it lower on the tooth, higher up, or even sideways.
So they can actually reshape the gum line that way.
They can, yeah.
Wow, that's amazing.
It is.
Now, I know there are also specific types of flap procedures,
Right.
like the modified Widman flap, for example. What can you tell us about that one?
The modified Widman flap is often used for deep cleaning below the gum line.
Oh, okay.
It focuses on getting to the root surfaces.
To clean them,
To clean and smooth them,
to
exactly.
help the gums reattach.
Yes, and to create a healthier environment overall.
So it's not actually reducing the depth of the gum pockets, it's more about cleaning them really well.
Exactly right.
What about the apically displaced flap you mentioned earlier? What's that one all about?
That one and the undisplaced flap, they're both used to reduce pocket depth.
So they're actually shrinking those deep pockets.
They are. They reposition the flap lower down on the tooth.
Oh, I see.
So the pocket becomes shallower.
So that's not only getting rid of the bacteria that's hiding down there, but it's making it easier to clean.
That's the idea.
Smart.
It is.
Now let's circle back to that papilla preservation flap.
Right.
That one sounds really precise.
It is. It's all about keeping the gums looking natural.
So they're very careful with the incisions and how they handle the tissue.
Exactly. They want to make sure the papilla stays healthy and in place.
Now what about those back teeth, the molars?
Mm.
Do they present any unique challenges?
They do. Molars, especially wisdom teeth, can be tricky to work on.
How so?
Well, upper molars tend to have thicker gum tissue,
Oh, I see.
and lower molars, there's often not much space back there.
I can relate to that. It feels pretty cramped back there.
Right. It's like trying to operate in a tiny little space.
So how do surgeons adapt their techniques for those back teeth?
Well, for upper molars, they might use special instruments to get through that thicker tissue.
Makes sense.
And for lower molars, they might choose flap designs that maximize access.
So they can work in those tight spaces.
Right. They might combine horizontal and vertical incisions.
To create a flap they can really maneuver.
Exactly.
So what have we learned today? Basically, dental flap surgery isn't a one-size-fits-all thing, right?
Definitely not. There are lots of different techniques.
It all depends on the problem and the tooth they're working on.
Exactly. And when you understand the terminology, you can have much better conversations with your dentist.
You can ask better questions and really understand what they're proposing.
Right, and that helps you make the best decisions for your oral health.
Absolutely. Plus, I think it gives you a whole new appreciation for what dental surgeons do.
It's incredibly precise work.
It really is.
And with all the advancements in dental technology, it's exciting to think about what the future holds.
I know, right? Who knows what amazing techniques they'll come up with next.
Exactly.
Well, that's it for today's deep dive. We hope you found this exploration of dental flap surgery informative and maybe even a little bit fascinating.
We did too.
Thanks for listening, everyone.
See you next time.